now?
In the early 1970s, I studied body chemistry balancing with Dr. Melvin Page in Florida. He trained approximately 275 physicians and dentists in his technique before he died in 1983 at the age of 93. He developed a system of anthropometric measurements, or body measurements, to determine your inherited glandular pattern. From these measurements, he could determine that only slight deficiencies in or excesses in glandular pattern can cause disease problems. His anthropometric system consisted of measuring 5 circumferential points on the lower leg and on the forearm. He formed a quotient by dividing the wrist circumference into the ankle circumference, and this gave a value for the sex hormones. The 1/4 measurement of the wrist into the ankle gave a value for the thyroid gland. The 1/2 quotient formed a value for the posterior pituitary gland, and the 3/4 quotient formed a value for the anterior pituitary gland. The knee and the elbow measurement is another measurement of sex hormone values. Based on this anthropometric system, he was able to determine that manic depressive patients have a severe deficiency of the posterior pituitary gland. And when he gave them posterior pituitary supplement, their problems cleared up. He also found that this condition is fairly prominent. 88% of women have some deficiency of the posterior pituitary gland, and 39% of men have some degree of deficiency of this gland. It's just when the deficiency gets to be extreme that you have the manic depressive characteristics showing up. Lower values for posterior pituitary deficiency can show up as hypomania and clinical depression. This chart over here shows a typical measurement sequence that Page would use. So we made 5 equidistant points along the leg, and then he made a circumferential measurement right here, which is indicative of the posterior pituitary gland. On the arm, on the forearm, he made 5 equidistant points also, and the halfway measurement up the arm is the value for the posterior pituitary gland. Based on these quotients, he formed a graph picture for the patient. In other words, this would be the ankle wrist value here. This is the 1/4 value here. This is the 1/2 value here. This is the 3/4 value here, and this is the knee elbow measurement. So this is indicative of thyroid, and posterior pituitary gland is here. Now the actual value for this patient is way up in here, which indicates extreme deficiency of the posterior pituitary gland. This patient happens to be manic depressive and has been so for over 30 years, and she takes typical medications for manic depression. We have more information on this subject at my office. You can call 412-655-2662. On my website is www.pittsburgh-dentist.com. There's an article on the posterior pituitary gland. At the site at the International Foundation for Nutrition and Health, www.ifnh.org, there's books of Dr. Page categorized and cataloged at that foundation. I wrote 3 books on the Page technique. One is called The Hormone Mess and How to Fix It. The second is A Magic Bullet Cure for Depression and Manic Depression. And the third is one called Parent Screen, so any parent can screen their child for manic depressive tendencies. In other words, you have to make a differential diagnosis of this problem in order to screen out ADHD and other problems such as clinical depression. So manic depression has to be made, you have to have a definitive diagnosis. If any other questions, just call our office, 412-655-2662.